Thank you for joining us on this exciting webinar on updates in progressive familial intrahepatic cholestasis prevented by myself and Nadia Ovchinsky. These are our disclosures, and now I'll hand over to my colleague, Dr. Ovchinsky.
So really one of our drives to do this webinar was to discuss this very recent opinion paper in Journal of Hepatology on new approach to diagnosis and treatment of progressive familial intrahepatic cholestasis, or PFIC. And Pat, you were the first author on this, and I really appreciate your partnership in this. And I want to invite you to tell us a little bit about PFIC and what do we know about pathophysiology of this disease at this point.
Thank you. These are a group of rare genetic single gene disorders, which are autosomal recessive inheritance. They tend to present largely in infancy, and the major presentation is with neonatal cholestasis. However, they can present later in childhood and indeed rarely can present in adults. One of the characteristics of these diseases is their severe pruritus. And as any of you who are involved in the management of these children, we know that this has a serious impact on the quality of life. But these diseases are more than a nuisance. They're associated with progressive liver disease, and the majority of children will require surgical intervention or liver transplantation in the first decade of life. The first description of these depended on excellent clinical observation from within the Amish population in Pennsylvania. A group of 4 children descended from the Bile family were recognized to have this fatal disease, and which has often been called the eponymous biliary disease. Now, it was nearly 25 years later before the mechanism of the disease was explored, and it became apparent there was deficient of bile acids in bile. And then the speed of progress, the progress sped up, and it was 5 years later that the gene for this disorder was described at the same time as a gene for one of the other disorders. And since that time, there have been multiple subtypes of PFIC described, and now diagnostically we use mutation analysis as our primary diagnostic method. As I've mentioned, all of these disorders are single gene disorders, autosomal recessive inheritance, and a single protein that is involved in the production and or the excretion of bile acids into the gut is involved. We know the mechanism of many of these disorders, but some of them remain elusive.